Perfect. All right. Thank you so much. And just to confirm, thumbs up. Can folks see my screen? Can you see connecting the dots? Okay, perfect. Thank you. All right. I'm going to hand it over to Alejandro to talk about language justice, the fact that we have Spanish language interpretation for today. Alejandro, the floor is yours.
Thank you very much, Soraya. I'm going to go ahead and provide these instructions in Spanish first, although they do apply to everyone who's not fluently bilingual in both English and Spanish in this case. So thank you for your patience as I come back. Hola a todos, mi nombre es Alejandro Arrieta, seré su intérprete el día de hoy del inglés y el español, y en esta reunión queremos que puedan participar por completo en el idioma de su corazón o en el idioma de su preferencia, y por lo tanto vamos a estar usando la interpretación. Si usted prefiere participar en español, en un momento después de que repita estas instrucciones en inglés también, van a ver un icono terráqueo aparecer en la parte de abajo a mano derecha en su pantalla. Cuando aparezca ese icono de la interpretación, asegúrense de hacerle clic o seleccionarlo para escoger el español. Si es necesario durante la reunión, pueden regresar a poner el audio original en silencio. Si no es necesario, no lo tienen que hacer. Si no hay preguntas, voy a repetir esto en inglés y de ahí les regreso su tiempo para comenzar. All right, so once again, thank you very much for having me. My name is Alejandro Arrieta, and I will be your Spanish-English interpreter for today. And because we want to make sure that everybody is able to engage in this meeting in the language of their heart or the language of their preference, if you're not fluently bilingual in both English and Spanish, I will ask that you select your language as well. Remember that you'll see that globe icon appear on the bottom right-hand side of your screen. Once it pops up after the instructions, you're going to click on it and select English. If it happens to be necessary during the meeting where you need to go back and hit mute original audio, you can do so. Otherwise, you don't have to. And whenever we have breakout rooms, remember that when we come back into the main session, we need to reselect our language. So with that, I will go ahead and pass it over to our host to turn on the interpretation. Ya vamos a comenzar.
Perfect. All right, I'm gonna reshare my screen here. Thank you, Alejandro. Really, really appreciate you doing that. I know it's important for us to do that kind of at the beginning, so I appreciate your flexibility with that. All right, I'm gonna share my screen. And we're gonna go ahead and dive in. So welcome everyone to our third webinar of this series of this summer. And today we're going to talk about data. We're going to talk about mental health data, go through our mental health data dashboard. We actually have a couple folks from our epidemiology and data science team who are going to be talking a little bit. Well, one of them, Julia. So let's just do some quick introductions here. If I can actually advance the slides, there we go. So my name is Saria. I use he, him pronouns, mental health promotion specialist as part of the behavioral health team. I'm going to hand it over to Julia to introduce herself. You're going to hear a lot more from her later on today.
Hi, everyone. My name is Julia Brennan. I use she, her pronouns. I am an epidemiologist and data scientist at Adams County Health Department. And my coworkers, Robin Hart and Gabriella, are also here today to help with any questions you might have. So thanks for coming today to hear all about data.
Wonderful. Thank you, Julia. Emma, do you want to go next? Just a quick introduction.
Of course. Good morning, everyone. I'm Emma Goforth. I use she, her pronouns, and I supervise the behavioral health work here at Adams County Health Department. It's great to see you all here today.
Thanks, Emma. And Natalie.
Good morning, everyone. Natalie Salcido. I use she, her, ella pronouns. I am our community health promotion manager. Excited to be here with all of you. I'll be sort of behind the scenes today playing host, but excited to see faces and names in the chat. So welcome.
Awesome. And you're doing a great job of it. So thank you. All right. So just a little housekeeping. If you haven't already, please introduce yourselves in the chat. Name, pronouns, if you'd like, your organization, and your title or role. Just go ahead and put those in the chat. Let's keep those coming. As a reminder, this meeting is being recorded. We will send the recording and the slides after the meeting, so you can have that at your disposal. We already talked about Spanish language interpretation. So again, make sure that you go to that globe icon and select your language channel if you haven't already. And then let's go through the Jamboard. So for the last 3 of these, we've been using Jamboard quite a bit. And so I want to just do a quick tutorial for those who haven't used it before. We're going to be using it a lot today, especially for our small breakout rooms. So I want to make sure folks are understanding of how to use it and what's actually there, because there's a lot of great information on that. So I'm going to page over to Jamboard. And I just want to confirm, thumbs up. Can folks see that okay? Okay, thank you. So, and then perfect. All right, thank you. Looks like Natalie put that link in the chat. Appreciate it. So if you go to the Jamboard, you'll come to this page over here, and this is just a quick kind of table of contents to help you navigate. Use these arrow keys to navigate to different frames. We're going to start here at number 2. So as you can see, we switched this up a little bit. The last few has just been like boring emoticons, and we decided why not goats? So if you could, if you all would like to, go ahead and just put down how you're feeling this morning. And you can do that by going to this left-hand corner here, selecting this pen. You can also just click that little arrow and you can change the color. You can make a highlighter instead, a marker, whatever you would like. And go ahead and mark the place where you are feeling. You can do a star, a smiley face, whatever you'd like. For me personally, I'm feeling like I need a haircut. So I'm going to put a little star right there by this guy. It's a terrible star, but it's okay. So go ahead if you can. Go through and add your little mark over there if you'd like. And we're going to keep moving along here. Slides 3 and 4 are really there, as we talk about our proposed agreements, as we talk about equity. That's going to be a larger conversation later today. Feel free to add thoughts or ideas here. If you would like to do that, you use the sticky note. So go to the left-hand corner again, click that sticky note button, and you can type in your response. I don't know why the star is showing up for me on that, but okay. Oh, someone else may have done that. Okay. Go ahead and type in your response, hit save, and then it'll populate, and then you can move it around however you would like. So that's how to use the sticky note. And then you can always move the sticky notes around. You can make it bigger, smaller. You can double click on them if you want to adjust or edit them as you will. All right. And then as we keep moving along, slides 5, 6, 7, and 8 are going to be used for our small breakout rooms. We'll come back to these, so don't worry about them quite yet. Slide 9 is for any questions you might have for us. Slide 10, feedback in terms of content or facilitation. This is kind of our parking lot for any questions that you might have that maybe don't fit anywhere else. You can stick them over here. And then just information about our next webinar. And so we'll talk a little bit more about that towards the end as well, so that you have that information. Any questions on how to use the Jamboard? And I know that a couple of folks may not have access. I will say too, sometimes there is a cap in terms of how many people can be on the Jamboard at once. And so if that's the issue too, go ahead, once you're done putting your thoughts on the Jamboard, go ahead and exit out of it. We can always come back to it. All right, with that, I'm going to go back to our PowerPoint here. Are folks seeing that little star over there on the screen? I'm trying to get rid of it and I don't know what happened. Let me see if I can, I'll stop sharing it. It's not the biggest thing in the world, but all right.
So yeah, if you get a blue star for today, I'm all for it.
Blue star, gold stars, all the stars given to me. Thank you. Just doing so well. All right. So with that, we've kind of covered all the logistics. Let's just do a quick little roadmap of our time today. We've already gone through all these logistics and everything, so we're actually doing great on time. We're going to spend the next 35 minutes or so talking about data. That's the whole purpose of today's conversation. And we're going to start with just kind of a general overview of why it's important for us to look at data, talk about why it's important for us to apply a health equity lens to that. And then the spotlight's really going to be on Julia to help us go through the dashboard, to go through some selected mental health data from Adams County. And so the spotlight will really be on her for that part, and she's going to do an amazing job. We're going to spend a big chunk of time towards the end to actually give you all a chance to be in small breakout rooms, to actually talk through what you're seeing in the data, to interpret it a little bit. And so you're going to have a chance to be able to do that in small groups. And then we'll end with just some next steps in terms of what to expect from the rest of these webinars. All right, so today's objectives. What are we actually going to try to accomplish today? Well, first thing is we just want to say we're really excited to be here, working with you all, working together to leverage everyone's strengths here in this space, because ultimately that's how we build collective impact. That's how we can create a supportive and inclusive environment that promotes mental and behavioral health. We want to be able to do that by continuing to grow this network of community members and partners. We also want to take this time to share and reflect on data. That's the whole purpose of today's conversation. And we know data is important for us to actually understand what's really happening in our communities. And we know that this is something that you all really want. You all have asked for conversations about data, really diving deep into the data. And so we want to make sure that we can provide that here today so that we can have a meaningful dialogue about what the data means, how to use it, and how we communicate that data to our community. And with that, I'm going to hand it over to Julia to talk a little about why it's important for us.
Yeah. So thanks, Surya. Just before we jump into the mental health data and the website and the summary points, thought it'd be important to review why it's important to look at data in the first place. Next slide. So this is a pyramid. From a big picture perspective, at the top of the pyramid is the goal of improved health. And data is part of the foundation at the bottom of the pyramid to provide improved evidence and capacity. So we can then make informed decisions and then improved programs and policies that then lead to improved health. So data are pieces of evidence that we can use to make informed decisions to then improve the programs and then improve health. So that's like a big picture perspective. Why are we looking at data? And this is from a group called Data for Impact. And then I think Surya is going to talk more about data equity.
Yes, if I can remember to unmute myself here. The last few webinars, we've talked a lot about equity, right? And Natalie's given us some great overviews of how we're talking about equity here at the Adams County Health Department and in this behavioral health space, what it means to us and how we're applying those concepts and those principles. But as we were kind of drawing up, well, how are we actually going to talk about that with regards to data? We wanted to make more explicit connections between what we're actually talking about here today and these ideas of equity and justice and how we can apply those within a data conversation. And so Natalie actually put together this really great framework. It's a lot of information and we're not going to go into it in like super gory detail, but want to give you kind of an overview of what this actually means and how we're organizing our thoughts around data and equity and justice. And I want to start at the kind of that circle in the middle there about being evidence and research informed and having community engagement throughout the data lifecycle. And let's talk a little bit about what those both mean. And when we talk about being evidence and research informed, we recognize that, yeah, we're informed by data, we're informed by research and evidence, but we're not limited to them. And we really want to be able to expand that definition to include qualitative data and to really ground data in the context of history and current events and individual stories. Peggy, I saw your chat saying that you still don't have access to the Jamboard. Feel free to work with Natalie on that one. She might be able to help you with getting access to the Jamboard. Thank you. Community engagement through the life cycle. And this means engaging partners like we're doing right now throughout the data life cycle with data collection, how we analyze it, how we interpret it and make meaning out of it, and then how we disseminate it, right? And that's all part of being able to engage community in that process. Now, there's some overarching principles around that circle, though, and we're going to just kind of start at the top, data collection, and work our way clockwise. So we collect the data first, right? That's the first step in collecting data and being able to use data. And the first thing is equitable sampling. So we sample for reliability without discounting small sample sizes. And that does really mean kind of questioning some assumptions about secondhand data and setting some equity standards in terms of how, when, and where we get our data from. And this does include paying people for their time when they're participating in data collection. We also want to be transparent about the limits of data collection because there are limits to that, right? We have to understand where the data comes from, what's available, and any areas for improvement, and any areas that we can apply some cultural modifications to the data as well. We want to be trauma and culturally informed. So we want to be able to seek informed consent to participants. We want to avoid re-traumatization, acknowledge power dynamics, and also ensure the security of people's data, because that is important. Now that we've actually collected the data, though, we're going to move forward and go into analysis, right? So how are we actually analyzing the data? And got a little carried away. One of the key pieces here is disaggregation. And what that means is basically taking the data and pulling it apart. So if we see data kind of as a population, then looking at data with regards to gender or sexual orientation or race and ethnicity. And by doing that, we can actually help to see a more accurate and a more complete story. And when we talk about telling the story of data, we do have to consider intersectionality. What that means is basically this idea that different social categories intersect in different ways at an individual level, and that broadly also speaks to interlocking systems of oppression and privilege. The experiences of a person of color who is heterosexual may look different than the experiences of a person of color who is in the LGBTQ+ community. And we have to be able to acknowledge those things and to bring that into our data analysis. Now that we move into interpretation, how do we actually mean and create meaning out of the data? We do have to recognize the importance of what our implicit bias might mean and being able to combat that. We all have implicit bias, so how do we combat that? We have to lead with curiosity. We have to ask questions, we have to seek clarity and interrupt those assumptions. And we also have to ground things in historical context, because that's the why behind the disparities and why they exist. We don't want to blame or continue to marginalize communities for the inequities that they've experienced or continue to experience. And so being able to ground ourselves in historical and current context helps to do that, and it helps to ground us in conversations about systems of oppression. And then understanding the difference between inequities and disparities. Disparity does imply, a difference of some kind, but inequity talks about the why behind that disparity, because health inequities are health differences that are systemic, they're unjust, and they're avoidable. We can actually work at them. We can actually work on them. And then finally, let's just talk a little bit about data distribution. So kind of what we're doing right here, right? Being able to provide this information to folks in a way that's digestible, in a way that's actionable, so that community members and partners can actually use this data. And that we're transparent in doing so. We're transparent about the data itself and in the limits of it as well. So that's a lot of information, but hopefully that's a good overview of some of the principles that we're grounding ourselves in when we're talking about equity and data. And you're actually going to have a chance later on in your small groups to kind of revisit this framework a little bit. We're going to keep working on this framework. We're going to keep refining it over time, but we want to make sure we share this with you first, that you have a chance to react to it, and you will have a chance to kind of reflect on it a little bit more in our small groups. All right, with that, I'm going to hand it back over to Julia.
Thanks, Surya. So to jump into our main objective, let's look specifically at mental health data in Adams County. And where would you find this data about mental health in Adams County? I have put in the chat 4 links. One is for the Adams County Health Department data site, which will show the mental health data site itself, and then 2 data source links. So those are in the chat. They formatted a bit odd, but they're numbered for you. So there's 4 links there. Next slide, please. So we have a whole website devoted to Adams County health data and maps, and you can find at this link here, and then it's also at the chat. I know it's a long link to type in, so we've provided that in the chat. And there are different sections to our health data site: the open data portal, a data request form, we have interactive maps, and then we have data sites and data reports. And the data sites, there are 3 there right now. There's one on aging, mental health, and substance use. So we're going to be reviewing the mental health data site today. And I'll navigate this navigation, or I'll demo this navigation later for you. So don't get too caught up in the weeds right now. Next slide, please. Again, this is a link for our mental health in Adams County data site. It's also in the chat. And all the data and visuals that we're reviewing today are found at this site. Next slide, please. So we're just going to jump into the data itself. We try to use data sources that address different topics related to mental health to tell a more complete story. So this includes gathering data about risk factors for the topic we're looking at, protective factors, and then outcomes and resources. And so this is a list of the data sources we've used in the mental health data site for Adams County. We have the behavioral risk factor surveillance system, which collects adult behavior data in a survey. We have vital statistics data, which pulls data from birth and death records, but for this topic, we look at death certificates. And then the two data sources that we're going to highlight today are the Colorado Health Access Survey, the Healthy Kids, and the Healthy Kids Colorado Survey. More on that later. We also include information about the violent death reporting system and then treatment centers from SAMHSA. These and the links to the two data sources, Colorado Health Access Survey and Healthy Kids, are in the chat. Next slide. So how is the data site organized? I know sometimes it can be overwhelming to look at a website full of data. So the data site is broken up into these sections. We have our introduction, a section for data and resource web maps, and then health access to, mental health and access to care in Adams County, and youth mental health indicators. Those are the sections we'll review today, and then future webinars will focus on the suicide sections. And then there are also areas at the bottom of the site where you can find links to our mental health promotion site, substance use data site, and substance use prevention site. So that's a lot, but just to give you a lay of the land there. The first section we'll go over is the mental health and access to care in Adams County. This section displays data from the Colorado Health Access Survey, or CHAS, as sometimes it's referred to. And the purpose of the Colorado Health Access Survey is to interview people about their health insurance coverage in Colorado, and this includes access to care and use of care. And sometimes, or not sometimes, but some of the measures included are specifically about mental health. So you can get information on access to healthcare overall, and specifically mental health care. The latest data that was collected was in early 2021. If you'd like more information about the methods or more details about the Colorado Health Access Survey, we've provided the link in the slides and then also in the chat. Next slide, please. This bar chart to start shows the percent of residents in different counties in the Denver metro area, including Adams in the dark blue, that experienced a decline in mental health due to COVID-19 in 2021. And in Adams County, 37%, or 1 in 3 people, reported a decline in their mental health because of COVID-19. And this can include anxiety, depression, or loneliness. Next slide. This bar chart shows the percent of residents in Adams County and the surrounding counties that needed mental health or counseling services during the past year in 2021, but did not get them at that time for a variety of different reasons. And in Adams County, 15%, or about 1 in 6 people, did not get the mental health care they needed at the time. As you can see that you can see the other counties there, but in Adams County, it was about 1 in 6 people. Next slide. Following that indicator, this bar chart shows the list of difficulties that people ran into in Adams County specifically when they were seeking healthcare during the past year. And the number one difficulty seeking care was being unable to get an appointment as soon as they needed. And that affected 19%, or about 1 in 5 Adams County residents. If you read down the list, I know it can be a little small, but if you read down the list, you can also see the top difficulties that people faced when seeking care were related to cost and work schedules, followed by insurance and interactions with the doctor's offices. And I think now we have time for reflection. So I'll throw it back to Surya.
Yeah, so, we realized that this is a lot of information for you all, and we wanted to make sure we broke up, all the data with a couple of opportunities to just take a breath, reflect a little bit about what you're seeing and what you're observing with the data. It also ensures that you all are paying attention as we talk. So what we want to do is we want to use Mentimeter. For the folks who haven't used this before, it's an online polling platform, really simple to use. So there are a couple ways that you can go about this. So first, you could just go to menti.com on your web browser or on your mobile device and type in this code. The other thing is you could just use that QR code right there. It's going to take you right to it. So I'm going to page over to Mentimeter. And no, there we go. All right. Can folks see that okay? Thumbs up. Okay. So once you go to Mentimeter, and I see that about 9 people have joined so far, again, you can use this QR code over here to get right to it, or just go to menti.com, type in 2748-4312, that's the code to be able to get in there, and answer that one question. What is one word or image or number that stood out to you from these first few data slides? Just take 30 seconds, write down kind of your, oh, I guess that is a number that stood out to you. You shouldn't have to put in that code if you're already at the question. So hopefully that helps. There we go. So it's going to show up as kind of a word cloud, and we get to see everyone's responses in real time. So let's just take about 30 seconds to a minute. Let's see what people come up with here. All right, so we got a few responses here, and you also should see in the description of the question, the Spanish language translation of the question too. Okay, so we got a few responses here. I'm just going to kind of run through a couple that we have here. I think access seems to be the biggest one that's popping up. It's the biggest one on the word cloud. So it sounds like access is really on people's minds right now. Insightful, appointment, healthy kids, cost, work schedule, and interaction with office. So this sounds like there are some things that are really kind of sticking with people from this first section of the data. But access to me definitely seems to be the one that's really on people's minds. All right, perfect. With that, let's go back into the data. We're going to have a couple more opportunities to take just a breath and do some more of these questions. This is kind of the first of 3. With that, I'm going to go right back over to the PowerPoint and hand it back over to Julia.
Thanks, Saria, and thank you all for listening and participating. The next section that we're going to review today is related to the Healthy Kids Colorado survey. And this survey is a survey of middle school and high school public students and ask students questions related to their health status and their related experiences. So this is a really valuable data source because it goes directly to the source for youth and, captures their information in a survey in every fall. And for this data, the most recent data was collected in fall 2021. And there's a lot of information here, but to highlight its main purpose is an opportunity to get those experiences and that data from youth themselves. And if you want more information about this or to see more of the summaries, you can go to the link in the chat or the Healthy Kids Colorado survey site at the Colorado Department of Public Health and Environment. Next slide, please. So this bar chart shows 4 different mental health indicators that we can get from the Healthy Kids Colorado survey. And we'll review each of these 4 indicators. But the first one discusses how students felt in the past month. So over 41%, or over 1 in 3, students in public school in Adams County felt so sad or hopeless that they stopped doing their usual activities almost every day for more than 2 weeks straight. And that's a pretty large number to me. Next slide. The second indicator shows that 17%, or about 1 in 6 students, seriously considered attempting suicide over the past year in Adams County and public schools. The third indicator on the next slide shows that about 14% of Adams County public students, or about 1 in 6 students, made a plan about how they would attempt suicide over the past year in 2021. And the fourth indicator shows that 7%, or about 1 in 12 students, attempted suicide at least once over the past year for Adams County public students. And it can be tough to see this data so starkly in charts, and doing so can seem really impersonal because there's so much that gets boiled down into this one number. So I'd like to bring it back before our next reflection time, just to say that these numbers represent students sharing their experiences with us in a voluntary survey every fall in school. So it's a really valuable resource to have, and it's so valuable to have these feelings captured directly from students themselves in the data as evidence for us. I just wanted to throw that out there before our reflection time.
Yeah, thank you for saying that, Julia. I really appreciate you acknowledging that and kind of grounding us in that idea too. So it is heavy to look at. And hopefully we can have a little bit of a breather and reflect a little bit more again. So we're going to go back to Mentimeter, and we're going to have one more question for you here on this one. So again, hopefully you didn't page out of Mentimeter. If you did, again, use that QR code. It should take you right away to the question itself. I'm going to page back over. And so this next question here, again, it's the same code. How did the youth data that we just looked at connect back to those larger mental health trends that we saw with Adams County mental health? And this one, you can have kind of a short answer with this one. It's just going to start scrolling your responses. So go ahead and take 30 seconds, a minute, respond here with what your thoughts are. How did this mental health data for youth reflect back or connect back to the larger trends that we saw with mental health in Adams County?
Surya, I might just add that I think it's also okay for folks here to just reflect on what you just saw as well, if it's, you know, what's coming up for you as well.
Yep, absolutely. All right, so I'm going to read the responses as we keep getting them. So feel free to keep sending in your responses. So first one here, access to help. Yeah, absolutely. It goes back to what we were talking about too with access, right? Seems to be a big piece that we're reflecting on here with regards to the data. Access versus struggle, again, our youth need more mental health support and resources. Absolutely. So this is showing some gaps, maybe some opportunities here. People are struggling and there are not enough resources. Appreciation of people committed to working in mental health. Love that kind of strengths-based approach of looking at and reflecting at the data here. Access is a need for youth as well. Yes. So this is a need for youth as well as everyone else in Adams County. In general, people not doing as well and they need more support, that there's a big need. So we're seeing some gaps, we're seeing some opportunities here. Youth need solid support systems, resources, access, trusted adults for healthy youth development. Thank you all so much for these reflections. It's really helpful, I think, to kind of take a bit of a pause as we go through this data, just have some brief reflections on what we're seeing here. One more that I'll read out here before I move on. Many therapists want virtual meetings and youth prefer in-person therapy. Yeah, so maybe some other kind of barriers or things that we're thinking about as we kind of move into a space of more increased access to telehealth and things like that. And the numbers are staggering. Yeah, absolutely. Absolutely. All right. Go ahead and keep Mentimeter on your browser for now, because we're going to come back to this one more time for one more reflection question. But until then, I'm going to hand it back over to Julia.
Thanks, Surya. I know I need a breath. Take a breather. But moving back into the Healthy Kids Colorado survey data, moving off of what we just talked about, and disaggregating the data and breaking it out to see where we can focus attention if needed, is this chart shows the percentage of students who seriously considered attempting suicide during the past 12 months. And in this chart, it's separated out by race and ethnicity. And just to, if you're on the website, just to orient you with this chart, there's a drop-down menu on the right where you can navigate to 4 different measures related to mental health that we've covered today, broken out by race and ethnicity as identified by the student themselves. This data shows us on this chart that there are higher percentages of Black and African American and East or Southeast Asian students in public schools in Adams County that seriously considered attempting suicide during the past year. And this was higher than the other groups, but followed also by multiracial and white students in Adams County. We can also display this data on the next slide by sexual orientation. And again, on our website, you can navigate to the 4 different measures. But this
Julia, I'm
Yeah.
sorry to interrupt. Will you go back to the last one?
Yeah.
And just explain that asterisk. I think that's helpful for folks to know.
Oh, sorry.
Thank you.
Can you repeat your question?
Just explain the asterisks or the missing data, please.
Oh, yeah. So with the asterisks, so we don't display data that is too small that could be potentially identifying in our visuals. So if there's a star next to the Middle Eastern, North African, Arab, and the Native Hawaiian and other Pacific Islander groups for this chart, that means that there were responses for those groups, but the numbers behind those responses were too small to like accurately provide an estimate. So it's not that they're missing, it's that they're too small to be relied upon, if that makes sense. So we're not excluding them, we're more like protecting them because the numbers are too small.
Thanks,
Yeah, good
Julie.
question. Thanks for interrupting. This next slide. Okay, yes. So back to this slide. In 2021, there were higher percentages of LGBTQIA+ students in Adams County who seriously considered attempting suicide during the past year compared to their fellow students who were straight. And again, like I know I need a breather after this data. It's really heavy. And it may not be surprising to you, but it's important to think about when we are looking at this data. Is this reflecting what you see in your communities or you feel are the main issues or things to address? And then what is the data also telling us that can add to your understanding of the problem? And with that, I think we have time for reflection and breathing.
Gotta remember to unmute myself. Yeah, I really appreciate you saying that, Julia, too, about like, is this data surprising? Like, wow, is this actually resonating with folks in terms of like, is it surprising or is this what we're actually seeing in the communities? And we're actually gonna, for our last Mentimeter reflection, actually answer that question. So let's go back to Mentimeter one more time. And the question we have for you is very simple, actually, and it really is just, were you surprised by this data when we looked at this? And you could talk about the youth data or just any of this data in particular, or specifically how we talked about this disaggregated data with, you know, race and ethnicity and sexual orientation with youth. Was this surprising to you all at all? And let's just give it a few seconds here for folks to type in their answers. All right, so we're getting some responses. There we go. Yeah, so overwhelmingly, it sounds like people weren't really surprised by this. Maybe a little surprise here and there, and that's totally fine. If people were very surprised, that's okay too. But it sounds like we're all pretty well immersed in this data and this work at this point, that this isn't surprising to us, that this is what we're seeing in our communities. This is what we're seeing with the folks that we work with our partners. And this is more so validating the things that we're seeing. And so I'm glad that that's resonating for folks in that way. But it does indicate, yes, we have a lot of work to do. And that is going to lead us into a little bit of a demonstration on the data site by Julia. You can feel free to exit out of Mentimeter. We're not going to use it for the rest of today. Thank you all for using that. I know it's probably a new technology for some folks, but hopefully a really great way of getting some good participation and seeing what other folks are thinking as we continue to move along. So I will go back to the PowerPoint and hand it back over to Julia.
Thanks, Ria. For our demo, I know I've already added the chat links, but just in case, this is the link I'm going to be going to. Let me share my screen. So do y'all see the homepage for the Adams County Health Data and GIS resources? Hopefully you can. Looks like my Zoom is being a little glitchy.
Yeah, we can see it.
If you have questions, that would be helpful. Oh, okay, it was just slow. Awesome. So this is our Adams County Health Department Health Data and GIS resources page. And I'm going to turn off my video because it says my Wi-Fi is unstable. So on our Adams County Health Department data site, we have different sections like I mentioned before. You can go to this data request form and submit a data request. We have an open data source section where you can search through data yourself to get maps and different things. We also have a health data site and maps section itself. So we have our interactive maps and we have the health data sites. And this is where you'll find the mental health in Adams County site that we'll go to. Also at the bottom of the page, we have health data reports of Adams County overall. So just to throw that out there, if there's other topics you're interested in. But let's go to the mental health in Adams County site. And let me throw this in the chat. So this is where all the data has come from that we've been discussing today. On the mental health site itself, we start out with this section that provides contact info and some important links directly at the top related to mental health, including a link to our mental health promotion site. The first section is related to our mental health data and resource web maps. And we'll take a look at this poor mental health and depression in Adams County maps right now, but you can also find links to Colorado mental health facilities, density maps for suicide mortality, and then substance use mortality as well. But let's take a look at this poor mental health and depression map while we're on this section. So when you click on this link, this app shows up. And just to orient you, because this may be something new for everyone to see, the sidebar on the left provides like more detailed text and information about what you'll see on the map. And we can see that this map has two indicators on it: the percent of adults who experience poor mental health, and then the percent that experience depression for at least 14 days over the past 30 days. And this data comes from the Behavior Risk Factor Surveillance System, which we didn't cover in detail today, but is a survey of adults. And the most recent data we have for that right now is 2022 on this map. And the map is to the right. We have a legend at the bottom, and then we have different layers of the map that you can check on and off. So we have different boundaries, roads, municipalities labeled. And to turn them on or off, you can unclick the box or check the box. And we have two indicators. We recommend looking at one at a time instead of layering them. So click one for the to see the poor mental health map, and then click the other to see the map for depression. And it provides data on like the entire metro area. But since we're interested in Adams County, let's zoom in a little bit more to see that today. And let's say you're interested in a particular area in, well, you're looking at this map and you do a lot of work in Federal Heights. And you see there's some darker colors there, which indicates higher percentages of that population dealing with depression in this case, or mental health if we had the other map checked. So you can use these plus or minus buttons on the bottom right to zoom in to an area you're specifically interested in. And I'm working on a small screen, so if you have a bigger screen, it might be easier to navigate. So thanks for bearing with. But you can see if you zoom into the Federal Heights area, like let's say that's an area you have a lot of work in, or an area you're particularly interested in, you can see these areas of the map have darker colors in them, which means they have a higher percent of adults with depression. So maybe you know of things going on in this area. And let's say you also want to see like, oh, overall, maybe not specifically depression, but overall, what's the percent? Like, do these areas also have other poor mental health issues that they're dealing with? So you can click on that map and it shows you, yes, they do. So both of these areas, or both of these maps show that this area in particular in Federal Heights has a high percentage of adults who struggle with poor mental health or depression for more than 14 days. Let's see, there's something in the chat. Yeah, so is there a way to narrow down this information for specific ages? So that's a really good question. And we don't have that on this map, but I can include the links for the aging website, which might have some more related information. And also, if you are interested and would like to put in a data request, we can get more granular data for you in map. So that is something we can do if you have a specific area that you're interested in or topic for a specific population. Our team is able to get that information for you and see what we have available. So I don't think, off the top of my head, I don't think we have a map specifically on our aging website, but I haven't looked at it in a while. So I can circle back to you, Elisa. If you put your email in the chat, Elisa, I can respond to you as well. Yeah, for anyone else interested in aging adults, we do have an aging adults website right next to the mental health one. But this map is for adults, all age ranges related to poor mental health and depression. But that's out of time for me, but let me just hop over real quick to the rest of the mental health site. So we were, oh, looks like it's doing something. A weird delay going on. Okay. And, okay. Can you all see the website?
Yes.
Yes, we do.
Hey everyone. My Zoom just crashed, but I'm here. Let me share my screen just to wrap up the mental health site so y'all see all the data we have about it available. So on our data health website, this is the web map section, but we also have, if you scroll down, the access to care section, which we've pulled out some information from today, but you can see more slides or counties there highlighted. And then we have an entire section related to youth mental health. And this is where you can see those youth mental health indicators that we've reviewed overall. And this is where you can select different youth mental health indicators in this drop down. And we also have the following sections for suicide mortality rates and circumstances. And then at the very bottom, we have links to our mental health and substance use site. So we have our mental health promotion site, and then these other substance use data site and substance use prevention site that will be talked about in the future. And I think that's it for me. Thank you all. Sorry for the glitches, but thank you all for listening today, and I really appreciate your involvement.
Awesome. Thank you, Julia. I really appreciate you all. Really appreciate you walking us through all of that, and you're getting some love in the chat too about how the site looks and everything.
Thanks.
Yeah, I know you all did a great job on it, and I'm glad we got a chance to spotlight it. So we're actually going to have a chance for you all to dive into this data a little bit more. I'm going to share my screen again here. And in preparation of us doing this, Natalie, if you wouldn't mind sharing links to the data slides, that'd be great. So we're going to spend the next 20 minutes or so in small breakout rooms. We're going to have 5 rooms total. Folks who would like to stick with the Spanish language interpretation are going to stay in this room. And then everyone else will be distributed into 4 other breakout rooms. We're going to have 5 rooms total. You're going to have 20 minutes as a group to go through this data. And Natalie's going to provide just the slides with the data so that you have it in front of you for easy reference. You're going to use the Jamboard, and I know we're keeping you on your toes with all this technology here. We're going to use the Jamboard to actually capture your thoughts and your notes. And I saw something in the chat from Rebecca too about kind of a reflection that she was seeing from this data. That'd be great to bring into these small group discussions. So I'm going to bring us over to Jamboard here. And Natalie, after you do the data slides, if you wouldn't mind also putting in the chat the Jamboard link again, just one more time, that'd be great. Thank you.
Yes, and Saria, really quick, if I could
Yeah.
just let folks know, I'm putting the English data slides. Voy a ponerlos, oh, well, they're doing interpretation. I'm going to put the Spanish data slides as well. It is a link to Google, and so you will have to download it instead of editing it in the actual link. We aren't able to send files that are downloadable for whatever reason, so I'm linking Google. But you want to download that document if you're going to make any edits within the document.
Perfect. Thanks, Natalie. Thanks for that reminder too. Okay, so in your small groups, you're going to be using this Jamboard. Everyone's going to be using the same Jamboard, but we have already pre-populated sticky notes for everyone. So please stick to the group number that you have and the colors that we've assigned to you. You'll see your group number at the top of your screen when you go into the breakout rooms. Group 5 is going to be the one that stays here in this room. So the group 5 is going to be the room that uses the Spanish language interpretation. We're going to ask that you all start here at slide 5. And work your way down. So we're starting with just general questions about, what did you see? What did you observe? Spend a minute or 2 on these questions. You don't have to spend a ton of time on them. Move into these reflective questions. What did you feel? What reminded you of your experiences? From there, this is where we really want you to spend most of your time discussing the so what questions. How are you interpreting this data? What insights are coming up for you? And then finally, decisional. Now what? What can we do after this? Now that we have this data, now we've looked at it, what actions can we take? What takeaways do we have? So we're going to ask that you work your way with your small group along those 4 slides. Again, start just a couple minutes on those first 2 slides, spend most of your time on the so what and now what questions. You don't have to answer all of the questions. They're just there to guide you. Any questions on what we're doing here for the next 20 minutes? Okay, seeing no questions, I'm going to ask Natalie if you wouldn't mind sending us all into our breakout rooms.
It's going to take me just a couple of minutes, so bear
No
with
worries.
me.
No
But
worries.
we will get this done.
And while Natalie's doing that, we'll say, if we have time, we can do a little reflection at the end. We may not be able to get to that because we want to leave some time at the end to be able to go over next steps, what we're going to see in the next webinars. But again, hopefully you should have some time. You should have some time in these small groups to really reflect on the data. Emma, did you have a thought?
Yeah, I'll just add that this is going to be an iterative conversation. So we will certainly make sure to reflect back to you all in the notes some of the themes that we're seeing. And again, towards the end, I'll talk about some of our next steps, but we will make sure that all of this information comes to you in a couple of different forms.
My only issue, I'm sorry, is who will be in the Spanish interpretation room?
Natalie, can you stay?
I'm saying participants that need to be in the Spanish interpretation room.
I see.
Bear with me just a moment.
Okay, that'll work.
Okay, since Alejandro is doing interpretation, if we can just let folks know if they're in a room, if they end up going into a breakout room, we'll want them to come back to the main room so they can just exit themselves out of the breakout room if they happen to be in one. So thank you, Alejandro, for sharing that interpretation. I'm about to open all the rooms and you will find yourself in a breakout room pretty soon here.
Thanks, Natalie.
Alejandro, are you with us?
Yes, I am.
Okay, I turned off the interpretation so you could join us here. That work?
Sure. Normally, the point of leaving Spanish speakers in the breakout in the main session is to be able to use the interpretation feature.
Sorry
So
about
we
that.
normally leave it on, but I'm not sure if it's, I think we only have one participant, right? Bianca, ¿usted prefiere el español? Okay. Yeah, I'm not sure, but anyway, yeah, we can just leave it on. And just a quick reminder too, when people come back from breakout groups, they need to reselect their language. So yeah, if you are gonna have like a group discussion or something like that, it'll be a good reminder to ask folks to do that again.
Okay, because I'm not seeing, well, I did turn off the interpretation, sorry.
Right.
That's, okay, so you're saying keep it off? I know that normally you said what you do, but just keep it off for now?
I would just turn it on and reassign me. And then when folks come in, one of you know, like, for example, you were, I think I mispronounced his name earlier.
Maria?
Saria, somebody can just let folks know, hey, reselect your language. And then I think it'll be fine.
Okay. So let me start the interpretation again. I won't be able to talk with you like I am now, right? Once I start that.
Yeah, so you can't hear me unless you select the language. So if you want to talk to me, you can, for example, select the English language or Spanish, whatever you feel comfortable with. And as long as we're on the same one, we'll be able to hear each other. And then if you don't want it again after that, you can always turn off your own personal language selection if you're bilingual.
Yeah. Okay. Wonderful. I'll start it back up then.
Cool.
Bianca está con nosotros. ¿No estás ahí? Are you there, Alejandro?
Yeah, can you hear me?
Yeah.
Yeah.
Could you hear me when I was on the Spanish language line?
Yeah, I could hear you. I could hear you no matter what channel you're on.
Oh, okay. Gosh, I need to get better at this. I don't think Bianca's with us, so I'll just stay in this room. But if she joins us again, we can continue on. If not, we'll just bring folks back from the breakout room in a little bit.
Okay, sounds good. I also did a check on the Spanish channel and asked her if she was here and didn't get a response either. So we'll just hang out. I'll be here when you need me.
Thank you, Alejandro.
Like, here we go. I know anytime we do these discussions, 20 minutes feels like so long until, you know, a second goes by. It's like, oh, we're already done. But again, like Emma said, this is an iterative conversation. This won't be the last time that we talk about this data and talk about it together. So hopefully it was helpful. It sounds like we've got some really great feedback here in the Jamboard that we will be able to go through later on. So thank you so much for recording those thoughts. Thank you so much for going through this in such depth. And I hope it was helpful for you all in your understanding too of this landscape. I'm going to, I think Emma, you wanted to talk a little kind of next steps, the roadmap here. I can hand it over to you if you'd like to kind of cover this section.
Yeah, let me do a sound check. Is my sound okay?
Yep.
Okay, it got weird in the breakout room for some reason. So, and I will say that I think we can go through some of this fairly quickly. So I wonder if we want to just take like 2 minutes to see if anyone wants to share a key reflection or two from their workout. We should have been working out while we were doing that. Their breakout rooms. Any key insights that anybody just really wanted to share here briefly before we move on?
Just real quick, we talked about creative, non-Western alternatives to like formal mental health therapy chats and things like braining circles or hairdressers, religious communities, and providing mental health first aid training to them.
Awesome. You know, our breakout group had 2 people from Arapahoe County. So we spent a lot of time talking about how borders don't necessarily mean a whole lot for people living in communities, and the importance of you know, really looking at this data through a whole person lens. And maybe one last takeaway. Or if not, that's okay. We'll take some time to go through the notes and try to pull out some themes. So yeah, if we want to move on to the next slide, just wanted to root us a little bit in sort of where this work has come from and where we're going. And so I think most of you have probably seen a version of this timeline before. And this is really Tri-County's work and the work that we have done with community partners over the last several years in trying to understand gaps in assets within the communities. We developed some frameworks around mental health and suicide prevention. There was ongoing work related to opioid and overdose prevention. And we've done a lot of conversation with you all, which is part of what where we heard how important data is for you all to be able to access and use in your work. And we've made that transition from Tri-County onto the next slide to here at Adams County. Really, Surya, can you move the next slide forward, please? Yep. So really moving that into reconvening our partners. And we started by just bringing folks back together and introducing ourselves, but also engaging in this data webinar series. And so we'll be doing a very similar format around substance use data next month. We will do another session that's really focused on suicide in September, which is a suicide prevention awareness month. And then we'll do another one focused on just the Healthy Kids Colorado data, not only mental health, but substance use and some of the shared risk and protective factors data that comes there from that resource. And then as we move into the fall, you'll see us begin to start putting together some programming. So we will be convening co-responder programs here in Adams County. We'll be conducting an assessment around behavioral health services and supports. We're beginning to roll out some training around mental health first aid and other stigma reduction activities. And starting in 2024, we'll really be focused on our coalition and activating all of our partners for some collective impact towards this. And some of that will include community grants coming through our ARPA, American Rescue Plan Act funds. So lots to come. What I will say is that somewhere in between the end of 2023 and 2024, we'll also be looking at alignment with our community health improvement planning process, which Kelly Preheim shared with you last month. And we'll keep you posted on that alignment there as that moves forward. But this is just a little bit of a snapshot, and we'll have more details as we go forward in terms of where we're going in the coming years. So next slide. So this is just a preview. We will be doing the substance use data webinar next month, and we have registration information available for you at the end of the Jamboard. We'll have the registration link in our follow-up email. So more to come in terms of how we get that information out to you. But in the meantime, we definitely will take your input on how today went, and if this was working well for you all, or if there's improvements that we can make in terms of how we share data and create space to really reflect on it. Next slide. This is a snapshot of another page in the Jamboard. This is always helpful for us, for you to give us your thoughts about how today went. So if you want to drop any sticky notes on this slide, I forget which number it is, towards the end, just curious to hear from you about what worked for you, what you might change if you had wishes, anything that you're just curious about that we didn't talk about today. And certainly always love to engage folks in thinking about what are you going to do with the information or the discussions that we had today, any action that you can take with you, whether it's sharing with other colleagues or spending more time on the data sites, or whatever else might make sense for you in your forward looking. So encourage you to use this tool. Next slide. Oops. And then really here's this, again, this information about the next forum or webinar in August 30th. We will be sending the recording and materials out via email, and we're working on getting these resources posted online as well. That's taking a little bit longer, but you'll have them in your email. And really just want to, on our last slide, just give some acknowledgement and appreciation to our teams that have contributed to this work. And mostly just thank you all for being here, for engaging with us, for continuing to explore what we can do with data, what we can do together as partners, and hope that you'll continue to join us as we move forward. We cannot do this work alone. We have to do this work for our communities. I want to echo just very lastly as an ending thought, this idea that the data are people, right? And there's a great quote that I always like to invoke from Dr. Silikov, who says, you know, data are just numbers or statistics with the tears wiped away. And so we know this is very important. We appreciate your commitment to engaging with us here, and we hope to see you next time. So thank you all, and hope you have a great day.